Encounter is brought to you by the Broome County Council of Churches, where we connect compassion with needs as we inspire growth with dignity. You'll find us in special places throughout the community. For those who remain hungry, we provide meals. For those who are challenged, we build wheelchair ramps. We comfort those who are ill, minister to those who are confined, and we remain an advocate for change and understanding on behalf of every element of our community. Connect and inspire. Encounter the Broome County Council of Churches.
My dear friends, welcome to the Encounter program, sponsored by the Broome County Council of Churches. I'm your host, Mark Kimpland, the pastor at the Endwell United Methodist Church. Being one of the four hosts of this program, one of the greatest delights that I have is finding out more information about services and agencies and missions and ministries in this area that I knew very little about, and this show is about one of them. And I would like to welcome to the Encounter program today our guest, Kathleen Gaffney-Babb, who is the president and CEO of Helio Health. Kathleen, welcome. I'm so glad you are here.
Thank you so much for the opportunity to be here.
Absolutely. Prior to doing this show, I confessed to you that I really didn't know and don't know a whole lot about Helio Health, but I'm intrigued in finding out more. Again, my understanding of what they do and what you do day to day, week to week, month to month is very narrow, and so I really look forward to finding more about what the vital services that you offer. So let's start here. Let's start broad strokes. Can you say a little bit to our viewers and listeners about the mission of Helio Health, or the vision, or those core values that are important to the work you do?
Sure. So I'll just preface by saying that 1 in 5 individuals are affected by substance use or mental health disorders. And so the work that we do is very broad, and it affects all individuals and families as well as the community. Our mission is to promote recovery from substance use and mental health disorders and other health issues. And what is very important as it relates to our vision is to provide high quality services and access to those services, so that those 1 in 5 individuals, their families, the community has access to high quality services.
Yeah.
The values, the people that we serve come first. That's our primary value. What that means is that the people, why we're here, why we come to work every day, why we're mission driven, is because of the people that we serve. The other value that we have is that our colleagues are our greatest asset, because without our colleagues, we cannot serve our mission and we cannot serve those individuals. So it's really important that the people that we serve, as well as our colleagues, have a sense of belonging, a sense of inclusivity, that this is where they find home, whether it's their professional home where they work, or whether it's their home where they get hope and healing, as part of our tagline references. And then the other part of our values is integrity. It's important that the people that work for Helio Health, the people that receive services, feel that value of integrity in our provision of services.
Yeah. Oh, that's wonderful. I mean, a lot of those words you just used are just amazing, with the idea of integrity and the idea of inclusiveness, the idea of accessibility. It's great to have and do, but if it's not accessible,
That's right.
Awesome. So can you give me a little history of Helio Health? How long have they been doing what they're doing and such things?
So we've started in this region just 2017. But in terms of our entire history, that's a brief period of time in the larger scope. So we started actually in 1920, long before I was there.
Yes, indeed, yeah.
We were called the Segola Club, and we provided services for what they called wayward women at the time, pregnant women who were not married. In 1959, our corporate purpose switched to more closely what it is today, which is to provide services, community resident services for men, which they then termed had alcoholism. Now they would call it an alcohol use disorder. We expanded then to women's community residents, and then outpatient services and inpatient services, and then finally residential and housing, all of which originated in Onondaga County. And then we started expanding into different regions. And we expanded because the region reached out to us and they said, we need your services in our area. Would you be willing to come? And so we are in Rochester, Utica, Syracuse, and Binghamton. And we also have an affiliation leading to a merger in Fulton Friendship House, which is in the Johnstown, Gloversville area.
Yeah. Wow, what a transformation.
It's been a journey. I've been part of that journey, lucky enough to be part of that journey for over 30 years, and I've seen that growth. I've seen also the increase of need in all the communities, both for substance use and for mental health. And so it really is humbling and honoring to be able to serve that need and provide those services.
Well, to be able to adapt and to see what those needs are and to be able to kind of change the focus or include more of a focus in all of that says a great deal about the work you do.
Thank you. So from the very beginning, even when our corporate purpose was more narrowly defined for alcohol use disorder, the people that we served also had mental health disorders too.
Sure.
Just we weren't licensed and or regulated to provide those services, but we were providing substance use disorder services and also providing mental health services because the people that we served had those. And so as we recognized that the needs of the people that we served also included mental health, but also included housing and residential treatment, we expanded those services to include that.
Yeah. So with this mission and the values and the purpose and all of that and some of this history, are there specific, let's narrow this down a little bit more, specific services that Helio Health now does day to day and week to week and month to month and such things? Are there specific areas and how are those services provided to the clients and the people that need accessibility to them?
So the first thing that typically starts with everyone is an assessment. So there is no wrong door to getting into care. So wherever someone presents themselves, whether it be in our inpatient, our outpatient, our residential, or our in-community services, we're looking to assess what are the needs of the individual. So that's where it starts.
Okay.
And that assessment is not just focused on your alcohol use or your mental health disorder. It's really focused on what they call social determinants of health. Do you have housing needs, employment needs, food needs? What are those needs and how can we work through case management to provide those services? So then when we assess what those needs are, we're also looking at what's called the level of care. Where is the best place for you to receive those services that matches the need? Mm-hmm. And so we have inpatient services, which includes medically supervised withdrawal, and inpatient rehab, which we provide here in Binghamton and Broome County, as well as Syracuse and Rochester. And then we also have outpatient services, so ambulatory services where people can come and go. Within those outpatient services, which are in Utica and in Syracuse, we are what's called a Certified Community Behavioral Health Clinic, a CCBHC. And so what that means is, in the umbrella of outpatient services, not only are you getting an assessment, you may need individual services or group services, you may need what we call psych rehab services, which is vocational services, targeted case management, peer support. All of those things can be provided in an ambulatory setting in a CCBHC. And then we have residential treatment. So individuals that may be more stable with their medical, psychiatric, or substance use, but they also need help with daily living skills or vocational readiness and structure and assistance with medication administration. And so those can be provided in a residential service. And we have residential services right now in Onondaga and in Oneida County, but we are in growth to have additional 50 beds of those residential treatment services in Binghamton and Broome County coming up in the next year. And then we also have in-community services. So our in-community services are outreach and engagement, peer support, clinical assessment. So instead of you needing to come to us, we'll come to you. So if you are under a bridge, if you are homeless, or if you are in a library, if you are at a school setting, we'll come to you and talk to you about what your needs are and engage and work with that referral to that right level of care. We also have with our in-community services in Onondaga County a recovery center. So it's a drop-in center. People can come in and play cards and get on the internet and do resume writing and those types of things and get support from their peers. And then we also have a training institute. So a training institute for our communities and all the communities that we operate will help train the workforce. So you can start with a GED or a high school education and we'll train you to be certified and credentialed. We'll use maybe potentially remitted tuition like I received when I first came to Helio Health, or scholarships to be able to go on to get higher education and be licensed and or credentialed. So our training institute, our in-community services, our inpatient, outpatient, residential, all of our umbrella of services are designed to help the individual meet their needs where they're at, whether it's their professional development if they're working for Helio Health, or their personal development if they're receiving services.
Yeah. Wow, that is a vast
It's broad.
array. It is.
Well, because
exciting.
substance use and mental health affect every area of a person's
Yes,
life.
yes,
It isn't
yes.
narrow. It isn't
Yes.
like it's like if I had an infection on my finger.
Right.
That infection on my finger could lead into other issues, right? It could get into my bloodstream, it could cause other complications, but if I start to deal with it and treat it in that one spot, I can then prevent it from getting more chronic and more problems, and I can really look at what those needs are. And so one of the reasons we have these vast services is because it can be a problem where we are really working in terms of our training, our mental health first aid that we offer in the schools to mitigate further problems, or it could be something that's more acute where someone needs withdrawal and stabilization services and they're in our detox.
Right.
So they need to be vast in order to meet the needs of the
Yeah.
person where they're at.
Yeah, I applaud that holistic approach.
Thank you.
That is wonderful. Friends, our guest today on the Encounter program is Kathleen Gaffney-Babb, the president and the CEO of Helio Health. As you were explaining the vastness and the holistic approach, and I hope this isn't too vague, so take it wherever you'd like to take
Sure.
this. Someone's watching, listening to this. How would they know, or what kind of wisdom or input could you share with them as to whether this vastness, the holistic approach, is for them? Maybe they're struggling with some mental health issues or addiction or whatever.
Sure.
Is there a litmus test that maybe someone might be listening to this and saying, maybe I should contact them? Or
They've already passed the first litmus test.
Go ahead. I'll let you go ahead.
So that litmus
Please.
test is, and I didn't mean to interject, but I'm
please.
thinking, that litmus test is, do I need help?
Yep.
Just even asking the question. I'm not comfortable in my own skin. Something's going on with my family and I'm worried. I'm worried about myself and I'm not sure if I need help or not. You don't have to answer that question. We're here to help you with that. And it doesn't mean that it's really important that substance use, mental health disorders aren't considered a moral dilemma, right? It is a brain chemical reaction that happens within our body. Maybe it's a reaction to trauma, maybe it's a reaction to continued substance use, maybe it's a reaction to things that have happened in our environment. But whatever that is, it alters our brain chemistry in such a way that we can't within ourselves fix it. Because if we could, we would.
Yeah.
I say that all the time to the people that we serve. No one really seeks treatment because everything in their life is going terrific.
Right.
They seek help because they need help. But that scope of help, that kind of continuum of help, it doesn't matter where you are on that continuum of help. The bottom line is, if you feel like something in yourself or in your family is just not quite right and you're not quite sure what to do about it, you can come to Helio Health and we'll help you.
So if I hear you correctly, the asking the question is really the answer.
That's right.
Okay, all right.
That's right.
And that's
the answer may be that you just need medication, or you just need to come in and talk to somebody for a couple of times.
Yeah.
The answer may be that we can help your family member. We also have children's services. Part of that CCBHC is we serve people across the lifespan. So from really early on children, 3, 4, 5, to adulthood and geriatric. So the answer doesn't need to be, and usually isn't, within the person right away.
Right.
What's in the person is they know that something's not right.
Yes.
And we can help you figure that out.
And thank you for sharing that, because that is so vital of someone wondering, should I, shouldn't I, or how do I, or whatever. Just that, the ability and vulnerability to take that first step and to at least ask those questions. What can you share with our viewers and listeners about Helio Health right here in Broome County? I shared with you before we came on my only exposure to Helio Health were some emails that I received, and I'm thinking, well, this is interesting. They keep sending them to me. That's wonderful. But what specifically is offered here in Broome County? Can you hone in on that?
So we started here, as I mentioned, in 2017, and there was an RFP that was put out by New York State Office of Addiction Supports and Services that said we need detox and inpatient services in this area. We have a high overdose rate. We have a high suicide rate, and we need services in that area. So Helio Health responded to that RFP, and we were awarded to come here, gratefully. And so within that service, we right now have 50 beds of inpatient care. and under the umbrella of inpatient care is medically supervised withdrawal and inpatient rehabilitation. So someone can come to our services here in Binghamton and receive stabilization, withdrawal services, medication if needed from their substance use disorder. Depending on their needs, they may then want to go to or need to go to our inpatient rehabilitation. It isn't a given that someone that comes in for detox needs inpatient or someone that comes in for inpatient needs detox.
Yeah.
That's where that assessment comes in.
Okay.
What do you need, right? And so those 50 beds of inpatient rehabilitation and medically supervised withdrawal, where we can serve whatever the person needs when they come in those 50 beds. And then after they're stabilized and maybe ready to go to the next level of care, we work with area providers to be able to get the person into that next level of care, whether it is outpatient or residential treatment or housing or employment supports.
Very individualized, which is great to hear. It's not a cookie cutter approach.
That's that person-centered approach, no, because there is no one size fits all.
Right.
You know, there really isn't, and so it's really important. Someone may need medically supervised withdrawal for their opiate use disorder, as an example, and so they may need medication to help with that, but they also may be homeless. Or they may have a home, but they may need help with their educational supports in terms of what's next for me. And so really being able to serve the person, meet them where they're at is really important to the care that we offer.
Yeah.
In addition to those 50 beds that we offer now, we also do education in the school. So we were at, I think it's Shenango Fork High School. Is that the correct name of the school? I apologize I don't have it down. But we've provided 74 students so far mental health first aid. And so we've helped the students in that school be able to look within their cohort and be able to see if someone needs help or needs support and how to provide that support. We've also done youth mental health first aid in the school to be able to train the staff, the teachers, everyone in the staff to what to look for in the students so that they can be more preventative and know what to do and what to look for. We're continuing to provide that youth and teen mental health first aid in that school. We're starting again next week to provide the next cohort of training.
Oh, how exciting.
So it is exciting.
That is wonderful. That is great.
We are in 18 different school districts in Onondaga County, and that is not just in providing the training, but actually we have mental health and substance use disorder treatment in the schools in Onondaga County. Wow. So in addition to the training there, we're also providing treatment. But back to Binghamton and Broome County. Yeah. So there'll be 50 more beds coming online of residential treatment. People that are more stable in their substance use and mental health disorder, but need longer term support, daily living skills, maybe assistance and prompts with taking medication, maybe assistance and prompts in knowing what their triggers are for their mental health concerns. So those beds will be coming online another year. Awesome. The construction has already started on the outside. I didn't, built a road out on the mountain, into the mountain to be able to have better access to care, that access to quality services. Yes. And then we'll be starting the work inside, I think in this summer, to be able to get those 50 beds ready. And then we're also in process of a 108-bed affordable housing, supportive housing model that will be on Court Street here in Binghamton. Wow. And that will come online in late 2024.
Oh. So exciting. Thank you. Friends, our guest today is Kathleen Gaffney-Babb, the president and CEO of Helio Health. I've been to your website. It's marvelous. What can you share with us about the people who work that are in the trenches here and such things? What can you share about what they do or even their training? Or I'll let you go with that. What can you share about that?
So I guess first and foremost, they're mission-driven individuals. Similar to no one comes into treatment because their life is going great. Well, very few people enter behavioral health care if they don't want to serve the community and do work for our mission. Yeah. So that's kind of primary purpose, right? But in terms of their education and their background, it's varied because we need everyone. Yes. It takes a village, I guess, is the saying. Yes. So we have peer supports, we have people that are entry-level counselors, maybe with a high school diploma, counselor aides. We have guest services to help people with their daily needs in those inpatient programs and make sure that they can navigate through and know what to do. We have clinicians that are licensed and credentialed or certified as social worker, licensed mental health counselors. And we have nurses and nurse practitioners and physicians and psychiatrists. So the background is varied because the care team is varied. In order to serve the needs of the individuals, it's different. And then in terms of that training, so we have a training institute. So someone can start with us with a high school education and then be credentialed to be an alcoholism and substance abuse counselor, and then go on to college and become licensed as a social worker or licensed mental health counselor. So whatever those needs are, we want to be able to provide them, not just for the people we serve, but also for our staff, for our colleagues, so that they feel invested in, that they feel that Helio Health is home for them.
Yeah, I'm a numbers guy. Is there a number of people, ballpark, that
we serve? Last year we served over 18,000 people a year.
Amazing.
And we have 1,000 colleagues, which include our contracted professionals as well as our employed professionals.
Wow, that is amazing. Let's say someone's watching and listening to this, and they want to get involved somehow, to help, to assist, to volunteer, to do whatever it is, and this is touching a nerve or touching their spirit. What would you recommend them to do if they want to find out more information?
I would recommend that they call us or reach out on our website. So if they reach out on our website, we have our careers page, we also have our volunteer page, we also have interns, volunteers, they can reach out that way. Or if they're needing services, if they or their family member, someone, their friend in their neighborhood is needing services, you could reach out through our website. You can also call our open access. So we have 24/7 open access where people can come and get care and get that assessment. Like, I know something's wrong, but I don't know what it is. And so they could call 315-471-1564.
Awesome. Let me ask you this. You've been doing this a while.
Yes, I have.
What have you learned along the way? Are there any major things that you've learned, either about humanity or about individuals, or I don't want to get too theological or spiritual here, but are there things that you've learned along the way that have kind of guided you in your life and such things?
Sure.
Okay.
And actually, I mean, my personal story of why I work here for Helio Health is when I started as a counselor. Because I knew that I enjoyed working with people and helping with people, but I didn't necessarily know why, what internally drove me. And it was starting when I started to work. I did an internship when I was getting my bachelor's degree in psychology at an agency that provided substance use and mental health disorder treatment. And I started listening to the people that agency served, and I was humbled and honored and inspired by their courage and by their vulnerability and by their willingness to change everything about their lives to do something different. During that period of time, my children were young, and my youngest daughter had a very significant severe seizure disorder that had a fatal prognosis. We were told she was going to die by the time she was 5 years old.
Oh,
and I was lost. And I really didn't know what to do. I was somebody that thought if I could just find the answer, then I would know the solution. And there didn't seem to be an answer at that time. And it was really listening to the stories of the people without telling them anything about what was going on with me. It was their humility and their vulnerability that really inspired me to continue in this field. And so I did continue in this field. I started working for Syracuse Brick House at the time, now Helio Health, and really was able to continue to be educated about substance use and mental health disorders, but continued to be humbled and inspired by the people that we serve. I'm grateful that the daughter that I just talked about, she did not have a fatal disease. We were able to go down to Johns Hopkins Hospital, which was this mecca of pediatric neurology. And it was a blessing, but it was also an amazing thing to be witness to see all of these specialties come together in an integrated way to serve the individual, to pay attention to what her needs were. So integrated care, Helio Health, they came together for me and continue to come together to me. And as I started to indicate, so that daughter, she is an adult and married and has a 7-year-old boy who is my grandson. So it's a continuing inspirational story, but it's a continual personal mission for me.
Yes. Oh, thank you for sharing that. I appreciate it. What's been the greatest joy in doing what you do, and what's been some of the sorrow in what you've done?
The sorrow is that there continues to be substance use and mental health disorders prevalent in our communities, and people are dying. People die of overdose, and people die of suicide. and people are suffering, and that continues. Unfortunately, especially with the pandemic, people were closed in and shut down. We've seen a rise in those things. So that continues to be a sorrow, and that my heart aches for them and for their families as well as for our colleagues, because they're witness to it every day.
Right.
And I am actually, it was just the other day, I was the snowstorm, and I was checking in and seeing how people were doing, and I'm humbled by them. I'm humbled by them almost to the point of tears, by our colleagues, because they suit up and show up every day to serve our mission.
Yes.
And so that joy, that inspiration that I continue to have is why I come to work every day. It's what wakes me up sometimes at night to make sure that we can do the best thing for the people that we serve and the people that serve them.
Yeah.
But it's both a sorrow and a joy.
Yeah. I think they call that life. It is. Yeah.
True enough. They do call that life.
It's what we do, the good, the bad, and everything in the middle, and all of that. We have about 2 minutes left and such, and I always try to have my guests who are kind enough to come on the show to kind of give their last thoughts. So if you could take about a minute and a half and just kind of share any thoughts that you want to share that have not been shared, or reinforce something for our viewers and listeners, I'll give you the floor.
Thank you.
Yeah.
The most important thing I want to say is that there's no shame in asking for help, that there's courage in asking for help, and that when you ask for help, Helio Health is there. We can be there for you. You just need to pick up the phone or walk in the door, and we'll provide the right care that you need at the right time. So please call. And your website address is? www.helio.health. That's simple. That's simple. It's very simple. Well, I just, this has been fascinating to me at the scope, but also not just the scope, but the individual effort to see people as individuals, and that hurt and are in need, and in the process of attempting to make them as whole as they possibly can be. And I will share this, that this no longer is going to be an email that I get every once in a while, but you folks are doing amazing, wonderful work, and I just want to thank you on behalf of this area for doing the work that you do, and I'm glad you get out of bed in the morning with both probably joy and trepidation sometimes, right. As we all do, to make sure the mission and the vision continues onward. So I truly want to thank you for the work, and if you would extend that to the I will thank you to all of those that do so day in and day out. It's very, very much appreciated. Thank you. I appreciate it. So thank you so much for being on the show, and I do again want to thank Kathleen Gaffney-Babb, the president and the CEO of Helio Health. And I just want to share this moment that if you are watching or listening to this show, and there is something within you that you know needs to be tended to or should be tended to in these areas, to please feel free to reach out and give them a call, or go ahead and visit their website, because they can make a difference, and I am now assured of that. So friends, I thank you for joining us today, and just ask God's blessings and God's peace to be with you in your everyday. God bless, and have a wonderful day.